Assalamu alaikum, peace be upon you, welcome. I have a brief message today in regards to agency, and agency specifically in regards to the vaccine mandates. Now, many of you have expressed concern to me and others like me about feeling forced, feeling weary, feeling something is amiss or afoul regarding these government mandates. I tend to agree with those sentiments, and I feel in my gut and my heart and my conscience that something is amiss as well. But I don't want to get lost in that conversation. Many of us have been having these conversations and have our own conclusions and beliefs about them, and I'm not here to challenge those. Whoever and whatever you believe, you are welcome to that, and so forth. What today's message is about is agency and what it means to have agency in a time of COVID mandates, COVID vaccine mandates. What is agency, you may be asking? Agency is basically the freedom to choose, the freedom to decide for oneself, the freedom to have one's own preferences and one's own beliefs actualized and operationalized in the world. Now, the counter argument to much of agency today is that we have a public health issue that is dependent on everyone's participation in the vaccine campaign. Science is telling us otherwise, however, that people who have been vaccinated are just as likely to have COVID Delta strains as the unvaccinated, and just as likely to transmit COVID as the unvaccinated. So the public health argument is a fallacy, right? But nonetheless, they will use it, and they are forcing it to force people's submission to the vaccine campaign. My problem with this is multifold, but the main issue I have is with the breaking of agency, the breaking of people's will. The breaking of people's will. Will is a function of the soul. And the soul in holistic medicine is what governs health, what governs vitality, what governs the equilibrating intelligence of our physiology, of our affect, of our mood, of our thoughts, of hormones, of our immune system even as well. And what we know is that when people feel like they can't choose, they don't have a will to enact in the world, seemingly or in reality, then they are weaker. They are more susceptible to toxic relationships, to addictive behaviors, and we may even say to immune-compromised conditions, which are the conditions in which a viral pandemic may take root. A virus moving quickly through a community or a country or the world itself may take root, may find home. The idea of COVID is always about susceptibility. It's not about this generic virus that everyone is going to get equally. Those who are obese, those who are comorbid, those who are elderly are significantly more prone to infection than those in their 20s and 30s who are relatively healthy or taking care of themselves, or just, not with, still subclinical, even if they have something wrong. It's not as pathologically taxing yet to cause an issue. You might get sick for a week or two, but it's not necessarily a big issue, right? But the whole conversation is about susceptibility. So here's what I offer people. Practical tips. If you decide to get the vaccine, you cannot feel forced. You should not feel forced to do so. When you feel forced to do so and you believe that the vaccine is toxic, the vaccine is going to harm you, like it likely will be the case that it will. This is the nocebo effect, which is the opposite of the placebo effect. As we all know, the placebo effect is basically you believe that something will help you, even if it's in reality inert. And because your intention, your belief of that thing is so powerful that it actually helps you. The opposite, though, is the nocebo effect, which is the fact that, or the idea where you believe something is going to harm you, and in fact it does. Even if it's inert, even if it is in and of itself inert. Okay, that is the power of the mind. That is a power of will, of agency. So I've been telling people who are feeling forced in places like Australia, for example, where the mandates are draconian. Wallahi, by God, draconian. And this is just, hopefully not, but perhaps the beginning of something really gross in our world. But those people, I've been telling them, and others around the world, if you are cornered into taking the vaccine against your will, you choose to take it. I hope I've made myself clear here that I'm not advocating for it. I'm not advocating against it. It's your choice. You have to do your homework and you have to choose. And you should have doctors that you trust that can give you good advice. In some cases, it may be better to take the vaccine. But if you feel in your heart it's not, and you're forced, don't be forced. Because the forcing is going to scatter. It's going to break your heart. It's going to break agency, break your will. And that scatters you internally, and that sends your entire system into disarray and makes you more susceptible. This is along the lines of the psycho, neuro, endo, immunological axis. The axis that connects your psychology, your psychological state, to your neurological state, the nervous system, to your hormones, the endocrine system, to your immune system, the immunological system. Huh? This is how these things all connect, okay? And so you understanding that is vital. So if you are going to take the vaccine, choose it. Choose it and have full conviction that nothing that God does not will to harm you will harm you. And if God wills something to harm you, and for that to be part of your journey, to be part of your struggle and challenge and your moral victory in the future in some way or other, then so be it, it will, right? But you believing that in and of itself, this thing will not harm you, and you not scatter yourself voluntarily for its sake. I totally believe that if you are to take the vaccine, you should believe that it's not going to harm you. And you take it and you say, Bismillahi alladhi la yadurru ma ismihi shay'un fil ardi wa la fis sama'i wa huwa as-sami'ul 'alim. And you believe it. That in the name of God, the one that through him nothing harms in the heavens or in the earth. Wa huwa as-sami'ul 'alim. He is the all-hearing, the all-knowing. You totally have that conviction. Now, again, I'm not telling you to take it, and I'm not telling you to not take it. I'm telling you, if you are being forced, don't feel forced. That will scatter you. Don't let anyone ever scatter you. You choose it, and you maintain your power, and you maintain your integrity this way, and everything becomes well. Everything stays well within you, and you're able to live another day, inshallah ta'ala. So I will leave you with that. I hope this helps you. I hope this serves you and those around the world that are feeling pressured and cornered by these mandates. Don't let anyone force you to do something that is against your will. You are answerable to your conscience. You are answerable to God for your conscience only. And this is not a public health issue. This is something much more dark than that. And God knows best. But this is about agency. And this is about health and decreasing susceptibility and increasing vitality. And agency is one of the most important things. And this is not something new. I've been talking about this for years. And those of you that know my work know this. So I'll leave you with that. I hope this serves you. I pray you all stay well and healthy and strong and connected to your hearts and to one another, and to believe in the good that's in the world inherently, and that God is taking care of everything. Alhamdulillah. Assalamu alaikum.